Good morning and welcome to the Standing Policy Committee on Community Services for Tuesday, February 3rd, 2026. My name is City Councillor Vivian Santos. I will be your chairperson today. I have other city councillors as well who are members of the committee, Councillor Emma Durand-Wood, Councillor Matt Millard, and we have members from the Winnipeg Public Service, our senior committee clerk, Mr. Peter Prinsloo. Firstly, want to acknowledge that we are meeting on Treaty 1 territory, the traditional homelands of the Red River Métis that we all have the privilege of living on. Also want to acknowledge ancestral territory lands and that our drinking water comes from Shoal Lake Band number 40 in Treaty number 3, and acknowledge our neighbors in Treaty 5 where our hydroelectricity comes from. Firstly, I believe Councillor Gilroy requires a leave of absence if possible.
I move that.
Okay, moved by Councillor Allard. All those in favor?
Aye.
Aye, it's carried.
And that was for a personal matter?
Correct, personal matters. And then I need somebody to move the minutes of the meeting held on January 9th, 2026 be taken as read and confirmed. Moved by Councillor Emma Durand-Wood. All those in favor?
Aye.
Aye, and then I believe we have addendum reports. If somebody can move a motion to suspend the rules to add 2 addendum reports, items 6 and 7. Moved by Councillor Durand-Wood. All those in favor?
Aye.
Aye. All right, we will move on to delegations. We had Councillor Wyatt, but he doesn't look like he's in the room. We will move on to Councillor Mays from St. Patel Ward to be heard in support of the city play structures, report 6. Good morning, Councillor.
Good morning. Thanks for having me. Councillor Allard will be familiar with this motion from Friday when we moved it to Riel Committee. Last week I put out a report about school play structure funding. Right now the model really relies on parent volunteers to raise funds either to replace old school play structures or to in fact build new ones at new schools like Bison Run or Sage Creek. There are exceptions to this. Some divisions put money toward it. The Winnipeg School Division, for example, to their credit, has been replacing aged out play structures with school division money. We were at Faraday School last week, which is a school that's over 100 years old, play structure aged out, and school division covered that. But that's certainly not the case in other divisions. So rather than simply saying this is all the fault of the province and the school divisions, I thought the city should take some responsibility. It would be unfair for us to start repairing school play structures and increasing taxes while other levels of government let them slide and let them get into disrepair. But we do have a role, and that is there are certainly circumstances where city play structures are located on school division land due to usually odd historical circumstances. In my ward, for example, at Wyatt School, at Darwin School, there's a city play structure. There are also a number of city play structures adjacent on parkland adjacent to school. H.S. Paul in Councillor Chambers' ward, for example. Then the total weirdness of Harold Hatcher School, where I'm told in Transcona, where I'm told the play structure straddles the property line between school land and city land. So what I'm requesting is just to get a report on where there are city play structures on school land and B, where there are city play structures adjacent to school property. Certainly I get, and I assume all councillors get, an annual list of the state of play structures in their ward. Sometimes that has condition assessment. I've talked to Jim Berezowski, talked to Cindy Fernandez, both of whom are quite supportive of this, to their credit. Jim has said, look, we may not know the condition of some of these play structures on school division land, but at least we would know the year they were installed. So he and I went through this morning, and Darwin School in my ward, there's a city play structure that was put in 2004. We might not know the condition, but at least we can know when it was installed. So also there are a number of relatively new play structures. Certainly I've funded some, other councillors have funded some. So it's not like every single one of these is in rough shape. if you look at the inventory in my ward, you would see, oh, well, that one got replaced in 2014 or 2015. We don't need to worry about that one. So it's an information gathering exercise. I think if we can take some leadership on the play structures we have on school land, that'll free up some of the school divisions to fund other aging play structures. Obviously, there's an equity lens to be applied here. Traditionally, the problem has been parents in wealthier areas were able to raise the money, and parents in less well-off areas simply couldn't raise the money. The irony is, with the increasing inflation in the cost of play structures, almost no one can raise the money now. So it's not inequitable; it's just totally inefficient. And places like Bison Run and Sage Creek, where the parents are, in relative terms, not badly off in Sage Creek or Bison Run, but they just can't afford it. They can't raise $400,000 for a new play structure. So the request is really with an eye to probably the next budget or maybe even the multi-year budget. Get this report, figure out where we have play structures on school land, or at Penner School, for example, in my ward, if you walked out there, you would say, that's a nice play structure they've got on the school property. Well, it's actually on a city park, but you could never tell that. So just trying to get a report that would provide that information. Really, what we're at this stage, I'm waiting on the school divisions and waiting on the Minister of Ed to make their move. Hopefully, the Minister of Education will announce some funding to help deal with this problem, because right now it really is inefficient to have these parents running around trying to run bake sales and cookie dough sales to raise hundreds and hundreds of thousands of dollars, and people are giving up because it's taking years. People are giving. I had one parent, Bison Run, say we raised like 16,000 last year, and the cost of the play structure went up 16,000. So we've just wasted a year of our lives, basically. So my attempt to do something about a problem that is not, it's not necessarily a problem we created, but I do think all levels of government should shoulder some responsibility here and try and do something, because this model where you've got people going out and doing fundraising has really become outdated. Winnipeg School Division gets that.
Brandon, your time is up.
Oh, I'll wrap up. Brandon School Division.
One more
minute.
Time, 1 minute by Councillor Lar. All those in favor? Aye. Carried. Go ahead.
Yeah. The Division Scolaire Franco-Manitobain puts in $50,000 a year to help fix up old play structures. Brandon School Division does the same. We don't have that approach in all the Winnipeg divisions, but hopefully we can do something. They can do something, and the province really needs to fund these ones at new schools. So thanks to Councillor Allard for supporting this at committee, and no great urgency on it, but it does sound like the department, from my talks with them, have this data, and it wouldn't be too onerous to get it together.
Thank you for your presentation. Any questions for Councillor? No. I did have questions, but you kind of answered it during your presentation. I'm not aware of any play structures that were located on school properties, but you had named a few that were located in your ward, but you had mentioned that there's a long-standing history that had happened. Are you saying like this goes back like 50 years, that when the city had installed play structures on school properties? Like, can you give me a bit of an example of one where it is a City of Winnipeg owned structure on school property? Like, I don't have any in my ward, so I'm not familiar with any in your ward.
Yeah, fair question. And I'm not. Hence the need for the report to find out, is this just a weird St. Vital thing, or is this, I mean, it isn't, because I know there's at least one in Transcona and there's one in Chambers' ward. I'll give you two examples from my ward. Vic Wyatt School has huge grounds, so the city uses the schoolyard for soccer. So the deal, I was told, was, well, we maintain the play structure, and I've done two of them at that school now, so we don't need to go back there. Darwin School is listed on my list of play structures. It's goes back to 2004 at least. God knows the history of that one. We do, there's some baseball diamonds on school property. Maybe the city programs those, and in return we maintain the play structure. But yeah, there's at least 20 years of history here, and knowing the city of Winnipeg, maybe a few decades more of these odd arrangements. And certainly there are some where you would think it was on school property, but it's actually on a park, like immediately adjacent, and all the kids just run out and use the play structure that's in the park.
So you're not necessarily, my second question, you're not necessarily looking at kind of the joint use agreements that we have with schools with respect to play structures. You're just looking for the just locations of the play structures and which ones are owned by the city of Winnipeg.
Locations, and we'll have some condition information, I think, on these. And Berezowski had said, well, we may not on some of the ones that are right on school property, and that's fair. But at least we know when they were installed. So Darwin was installed in, the staff tell me, in 2004. So it's probably getting close to aging out. Whereas Wyatt was installed with Rochelle Squire, so that was like 2-3 years ago. So that one's, we don't need to touch that one for another 20 years.
Okay. Good.
I should say a number of councillors have used discretionary funds. I'm aware of that. Brawadi, Luke's. It's not like everyone's been sitting on their hands here. Certainly, some of our colleagues and probably all of us have put some money toward these play structures. But it would be useful to know how much of a thing is it where we have them on school property.
Perfect. No, I appreciate that clarity. Thank you. Seeing no other questions, okay, we'll move on.
Thank you.
Thank you. All right. Moving on to our next delegation is Nick Casper, President of UFFW, to be heard in support of the Winnipeg Fire Paramedic Service Strategic Direction Update 2025, report number 3. Welcome, Nick.
Morning. Madam Chair, councillors. Thanks for the opportunity to appear before you today. I want to thank this committee for its continued work in support of Winnipeg firefighters, to acknowledge the public service and the fire chief for preparing this update. You'll hear today that WFPS is under extreme stress, but there are more fires, rescues, and medical emergencies than ever before, and that call volumes continue to rise to population growth and the drug crisis. And you've been hearing this for years. The reality today is this: WFPS is no longer under stress. It's reached a breaking point. We're no longer planning for the future, we're managing a failing system. The evidence is overwhelming, yet we continue to rely on a planning framework that no longer reflects operational reality. The current strategic direction was published in February 2020. It's created 3 core reports and relied on 2016 data. It was recommended or intended to guide the service for decades. That work was essential. It acknowledged serious infrastructure and operating capacity deficits that threatened the service's ability to meet its mandate. At the time, service demand was relatively stable, increasing only 5.4% between 2011 and 2016. The report projected that by 2040, WFPS would respond to approximately 124,000 incidents annually, an increase of just 31% over 20 years. In reality, WFPS exceeded that 17 years early. Since 2015, the service has responded to more than 1 million calls, a staggering number, but volume alone does not explain the strain. The nature of those calls has fundamentally changed. Medical incidents have always been the majority of calls every year, but between 2015 and 2025, those incidents increased more than 150%. The ratio of medical calls to fire rescue calls has nearly doubled, and in 2025, there were more than 5 medical calls for every fire rescue call. How we deploy our units has also changed dramatically. Calls requiring both fire rescue and medical units are now the largest and fastest growing category. Between 2015 and 2025, we experienced an increase of roughly 150% in those determinants. Medical calls where only fire units respond, once the exception, have increased by over 300% and now outnumber ambulance-only responses. Beginning in 2023, despite the addition of 2 ambulances and 20 paramedics funded by Shared Health, fire units began attending thousands more medical calls than ambulances, and this has continued every year since. This is not the growth that 2020 planning framework was built for. It's also not the level of service the fire department is designed or resourced to provide. The strategic direction described itself as a roadmap, a tool to prepare for growth well in advance. That's no longer the case. Not only were key recommendations never implemented, but even their full implementation today would be insufficient. We've grown far beyond the plan's assumptions, decades ahead of schedule, without an updated response. The report identified the need to significantly expand prevention, investigation, public education, plan examination, and training capacity. These recommendations were targeted either immediately or for completion by 2022. None were achieved. As a result, critical staffing shortages persist across every branch, station coverage has not kept pace with growth, and fire apparatus availability has declined. In 2026, Winnipeg will face record call volumes with fewer available fire and medical capable units than in previous years. Frankly, I can't believe I have to appear before council and administration and ask why, despite these increases, we have less fire apparatus on duty today than we did when this report was first published. WFPS availability reports state clearly, the primary function of frontline units is emergency response. NFPA require or national standards require fire units to reach 90% of high priority calls within 4 minutes of travel time to prevent fire spread and maximize survivability. That requires units to be available in their primary response area. That's a direct quote. The community risk assessment recommended adopting response performance objectives and reporting results annually. Standards set a total response time of 6 minutes and 20 seconds from the time of the call at the 90th percentile. And as early as 2018, we were already approximately 8 minutes and 20 seconds, and response times have worsened since. Today, we have the slowest fire response time among our Canadian peers, and we no longer publicly benchmark that metric, the metric that matters most when a resident calls 911. These are not abstract numbers. Fires double in size every 30 to 60 seconds, and survival from out-of-hospital cardiac arrest drops by roughly 10% a minute. For our members, this looks like homes burning and residents trapped, while fire crews are tied up on low-priority medical calls far from their primary function. In turn, responding crews often arrive too late to make a difference. WFPS prides itself on innovative integrated response model that has traditionally relied on greater fire unit availability. Just about done.
You need another minute, 2 minutes.
About another minute.
Another minute.
Minute.
By Councilor Lark, all those in favor?
Aye.
Very good.
Thank you. Relies on greater fire unit availability to augment ambulance response. Firefighter paramedics are proud of the role we play in providing life-saving care, but today's reality is this. Fire unit availability no longer exists, and the status quo is failing the people we're sworn to protect. In 2018, when council moved to a full cost recovery model for EMS, Mayor Brian Bowman stated that delivering a provincial health service should not come at the expense of Winnipeg property taxpayers. Today, however, municipal fire resources are absorbing medical demand at exponential rates without any corresponding investment. The cost appears as slower response times, reduced availability, accelerated heavy fleet wear, staff burnout, and worsening outcomes. On behalf of Winnipeg's firefighters and firefighter paramedics, I'm urging this committee to recommend the council direct the public service to do 3 things. First, update the community risk assessment, standards of cover, master plan, and strategic direction using current data. Just about done. Second, restore and publicly report annual performance metrics, including response times and apparatus availability, benchmarked against national comparators. Third, and most importantly, review the true costs and sustainability of the integrated fire paramedic service model and report back with the necessary investment required to restore fire and rescue availability to provide the level of service Winnipeg residents deserve. Our firefighters will always answer the call, but we need the resources to do so. Thank you.
Thank you. Any questions? Can you email though that document that you've been reading to me, please, and the rest of the committee?
Just my story, my
Yeah, your
notes?
speech, if you can
Yep.
email it to,
Absolutely.
yeah, that would be great. Any questions for, yeah, go ahead, Councillor.
Could you just, now that you have a little bit more time, could you go over those 1, 2, 3 requests again, just in a little bit
Yeah,
more
thank you.
detail?
So the requests were first, to update the community risk assessment standard of cover, the master plan, and the strategic direction using current data. So we did see an update to the fire underwriter survey earlier this year. That was one of 3 reports that the strategic direction relied upon. But you folks are, you're making your decisions and planning off of a document that, we've exceeded 2040 projections years ago. It's not sure how helpful that is to you anymore. Second was to restore and publicly report annual performance metrics or key performance metrics being response times and apparatus availability. So how long it's taking us to attend those calls at the 90th percentile and what our apparatus availability looks like across the city. I'd like to see those benchmarked against our national comparators. For years, we have fallen well short of the industry standard. And lastly, and perhaps most importantly, review the true cost and sustainability of the integrated fire paramedic service model and report back with the necessary investment required to restore fire and rescue availability, provide the level of service Winnipeg residents deserve. If our, simply put, if our fire apparatus aren't available 90% of the time in the response district, we're going to fail to meet that benchmark, responding in an appropriate time frame. And we're seeing the results of that quite frequently.
All the colleagues are writing down. I just want to, I guess, get a better understanding. I appreciate the asks. I agree with you in part. We'll have further, obviously, conversations with the chief as the report comes forward, but I just want to better understand. So updating the risk assessment in the master plan, I think makes sense. I think there is a time that we should be doing that because I'm seeing a lot of this information is quite outdated and it was during a different time and climate, right? We know from 10 years ago, issues were different than they are today. So I think getting an update on the risk assessment in the master plan is duly noted. However, when we're doing that and then at the same time in tandem, you're asking for a review of the true costs and the sustainability integrated, like, do you think we're getting a little ahead of ourselves when we're asking to do that as well as updating the master plan? Like when you say you want to update the master plan with current data, that's kind of going to show us the lay of the land. And then after that, we should be reviewing the true costs so that it's kind of, in sequence. Because if you do it at the same time, I feel like you're not going to get good enough information. Hopefully that makes sense. Question.
Yeah, and I think to your point, I mean, the strategic direction, those planning documents designed to guide your governance decisions, your investments, your funding to take us into the future, out to 2040, which we've left in the dust already. In terms of the unique, innovative service that we offer here in Winnipeg, one of the only in Canada being the integrated service model, we provide EMS services on behalf of the province of Manitoba Shared Health through a service purchase agreement. That service purchase agreement is negotiated and agreed upon by your public service and by council. We don't have the resources anymore. The fire apparatus at one time, 20 years ago, could augment the ambulance service by attending medical calls. We talked about the call volume increases we've seen. We don't need a review to know what our call volumes are today. We're experiencing by hundreds of percent an increase in medical calls, the cost of which you intended to be borne by Shared Health by the province. And yet we have less fire trucks on duty in 2026 than we had in 2025, 2 less units capable of responding to medical calls. In fact, our fastest growing number. So we don't need a governance plan or framework to know that we need more significant investment in fire resources to continue providing medical services on behalf of the province, or we need to take steps to protect fire apparatus availability from continued erosion. I'm not intimately familiar with the language in the service purchase agreement or how that's negotiated, but I do know that we have less fire trucks when we need more.
Any other questions for Nick? No, saying none. Okay, thank you. Taking a lot of notes. And yes, if you could email maybe just the 3 recommendations, that would be greatly appreciated, and we can discuss it probably more at length.
Thank you.
Okay, thank you. Seeing no other delegations, Councillor Wyatt didn't end up appearing. Okay, then we will move on. We'll move on to reports. Item number 1 is a verbal update on the encampment response protocol. I'm looking to see if our CEO, yes, hi, great, welcome. Morning.
My pleasure. Quick report. So, one thing I want to preface this report with is that, January was a particularly cold month, coldest on record. So we've, elected to be cautious with our enforcement efforts. Certainly, the feedback we've received from the sector is that, you know, this is a matter of life and death for people who are occupying encampments during weather like this. So we've been very cautious. We're working very closely with the province on a number of encampments to try to house people from the encampments as soon as possible. Some numbers I can share with you for today, though. The number of sites that have been actioned now since November 17th by the City of Winnipeg are 14 public properties. And again, just to repeat, that means that the property was flagged as a priority by our encampment coordination table, and one or more of the following steps were taken. So either an outreach provider dispatched to the site, made contact with the occupants and reported back to us. City staff were dispatched to the site to place signage and notification. The outreach provider offered housing, and once confirmed vacant, the site was remediated. So again, 14 public properties now on our list have been completed. 37 sites were remediated by the city, by our garbage removal teams. And so this includes many of the 14 sites noted above and others that were vacated due to fire or reported and confirmed vacant by the outreach provider. Our bylaw enforcement officers have done 85 site inspections. They've posted 119 signs now, and they've replaced 14 that were taken down and replaced. I just want to offer a couple other notes. We received a report from Main Street Project, who is currently our outreach provider for the 2025. They were working for the city throughout the year. For the first half, they had received a grant along with other service providers, but for the second half, they were working for us under an RFP process. They noted that during the 2025 year, they had 425 referrals to housing provided throughout the city, 74 referrals to EIA, 155 referrals to mental health supports, 112 referrals to addiction supports. They offered 3,321 transportation to shelter or safe space. And they did 12,897 well-being checks during that period. So just wanted to, because the outreach provider is such a big part of the work that we do, I thought it would be worthwhile at least sharing those statistics with this table. Similarly, just wanted to report that we're presently in a process to renew the RFP. So there's a window that's currently open and it closes on February 10th at noon. So we've had one proponents conference where we met with interested parties who are looking to potentially bid on the RFP. And it will be closed on February 10th with a renewal on April 1st. So we'll be able to announce that hopefully by early March or late February.
And that's for the rest of the year of 2026, or does it go into March of 2027?
It's for the rest of 2026 with the option of renewing for an additional year.
Okay, so it's April to December.
Correct, yeah.
And
budget is there until 2027. So we're hoping to fill both years if possible, but certainly just the end of 2026 as a trial period.
Since you brought it up, the RFP, is it different than, is the request a little bit different than when we first issued the RFP last year? Was there any, I guess, lessons learned, right? What were the changes from the previous RFP to what we're asking now in this new RFP? Are you able to kind of give us a high level, if there are any changes?
There were changes. So I think our thinking was in anticipation of council adopting the policy that was adopted on the 27th of November last year. we made some changes to the RFP, asking for an approach that supported that policy. And then some of the other higher level changes, we've elected to divide the city into regions. So there are two sections in the RFP that we're asking groups to bid on. One would be east of the Red River and the other is west of the Red River, with the option of bidding on both. Those are the most substantial changes. We've also asked groups to provide a quarterly point in time count, so we have better data on a regular basis specific to the encampments.
When you say quarterly, would you say quarterly time?
Point in time.
Oh,
Yeah.
quarterly point in time, and from that quarterly point in time, what information are you asking them to report on?
It's very basic. We're mostly interested in the number of encampments, the number of people in encampments. You know, and if possible, we'd like to have better data on locations. Encampments can be they fluctuate, so having that good regular source of data will be helpful to us in our work this summer.
Okay, I don't have any other questions. Any questions from council colleagues on this information?
Ready to move the report?
So I wanna broach some ideas here. So we're continuing to get verbal updates, but I would really like to get some kind of report, like something more in writing, if possible. So I don't know what you guys are leaning towards. I knew we wanted to continue to have these monthly verbal reports, but something a little bit more in writing would be, I think, good too. Do we still want to go with verbal reports, or do we still want to, can we move to some written quarterly reports? What's the, I'm just looking.
I mean, I'd love to see a written report.
Okay,
That would be something
me
new.
too.
So,
Yeah,
do you wanna take, like, do you wanna take the chair?
I think Councilor Gilroy was really wanting to have that regular, so I don't think moving to quarterly maybe, but I also wanted to respect Greg's time and so yeah, I don't know how much more time do you think it would take to convert, you know, this update that you just shared with us now into something in writing?
Yeah, I mean, I have it in writing here, so I'd be happy to share that. It depends, I guess, the format.
Mhm.
If it's okay to submit something that's just fairly straightforward, I'd be happy to do that on a regular basis. If you want something more in depth, if there's other information you'd like included, I could do that maybe quarterly, but
Could we maybe move it like in between and have like
Yeah.
every other month and then get the written report in so many months?
Yeah, I think that works.
Councilor Gilroy is here, but we are respecting
I would-
what it is.
One verbal reports as well.
Yeah.
Okay, well, because Councilor Gilroy's not here, let's do one more verbal. And then
Okay.
when she's here, I'll work with her to see, you know, because I think the verbals are very important. It's very helpful. I think this is good information. So let's continue with one more verbal next month, and then we'll see where we'll go from there. Okay? Okay, if I can have somebody move the verbal report.
All of that.
Okay, for information, all those in favor? Aye. Okay, moving on to places to go. This is an extension of time. I think that's great. That's you requesting it? Okay. Could you explain why you needed an extension of time,
sure.
Mike?
Well, I mean, the honest reason is because it's a corner of the desk, so it's taking me a little bit of extra time to complete the report. It's more complex than we anticipated. We've received a little bit more data and information about Amawigamig in particular. We've also been delivering the porta potty, the temporary public washroom program for a while. We've had some hiccups with that I'd like to share in the report that are relatively new, so 30 days is more than adequate, though. The report is generally complete, just need to.
Okay, I appreciate that. Somebody to support a 30-day extension, moved by Councillor Duran Wood. All those in favor?
Aye.
Aye, that's carried.
Thank you so much.
Thank you. Moving on to item number 3, Winnipeg Fire Paramedic Service Strategic Direction Annual Report. We have Chief. here, morning, and your team. It's here. Once.
Joining me this morning are reports to my immediate right, Linda Hattuti. So Linda is our program manager, oversees all of our capital projects within fire paramedic service. Followed by Deputy Chief Ryan Sneath. Deputy Chief Sneath is responsible for paramedic operations and training. And Lisa Gilmore, Assistant Chief of Community Risk Reduction. So in terms of the strategic direction update for 2025, the city of Winnipeg population, as we've heard, continues to grow. Growth in population plus poverty and older housing has put extreme pressure on the Winnipeg Fire Paramedic Service. There are more fires, rescues, and medical emergencies now more than ever. Finalized data for 2025 confirms that we attended greater than 140,000 incidents in 2025. And for committee, that averages more than 380 incidents per day in a 24-hour period. The master plan recommendations in terms of what was put forward in the previous master plan, the WFPS completed a number of key projects in 2025. These have all been previously reported, but they include the consolidations of Station 9 and 15. That's the station at Autumnwood and Cottonwood, which officially opened on April 2nd, 2025, was commissioned later in June. The installation of the modular station at 1310 Eaglewood Drive in Waverly West, again commissioned in January of 2025, in advance of the permanent station, which will be located at Ruth Crossing and Bison Drive, and we'll have some more information for you on the progress with that project shortly. Additionally, the implementation of the traffic preemption pilot study, which we are now going to be moving into full deployment. Additionally, there was budget highlights that were finalized late in 2025, which included additional firefighting FTEs for fire operations, 11.5 new paramedic FTEs from Shared Health, fully funded for community paramedicine, and the WFPS Wellness Clinic to support members in prevention and recovery from illness and injury. The master plan provides a roadmap for the department to respond to community growth and development. It was designed to be an effective policy-making and budgeting tool as well, and has been used as such in the development of our capital budget program, which is detailed in all of the budget documents. We must, however, take into account future housing and industrial development and the continued increased population growth in the city of Winnipeg. Significant recommendation from the master plan report was that no reduction in response personnel or vehicles should occur within the city of Winnipeg. And the report recommended increasing and repurposing response and support resources for the greatest efficiency possible. Some other key projects in the plan. Again, we had the consolidations of Station 9 and 15. But there's additional items as well related to meeting current safety and health requirements. Some of these included the minimizing the exposure of fire contaminants to personnel. So an example of something that we've achieved in that regard is the introduction of the PPE cleaning and maintenance room. That is a 24-hour facility that operates out of 2546 McPhillips for cleaning firefighting turnout gear. Additionally, there's been extensive work done to maintain the exhaust extraction units in all of our fire paramedic stations. This includes what's referred to as a Plimo-Vent style system, used also in consolidation with aeration systems. There's also been work on live fire training out at our academy, fire investigations training, and scenario-based medical training, which has been developed as a result of a number of reviews that the service has performed. There is also a need to increase the current complement within our training and fire prevention branch. That has yet to be achieved. Again, the report recommended increasing to 32 fire prevention officers by 2022. Due to budgetary constraints, we have not been able to achieve those additional FTE in prevention. And there's the continued work to increase our heavy fleet. We have had some positive movement in that regard in terms of our ability to procure additional aerial ladder as spare and some additional engines. Our ability to move forward though with additional heavy fleet purchases is very much tied to the money allocated to the Fleet Management Agency, as we do not hold the budget dollars for the heavy fleet. In terms of some of the data updates for the service, the report outlines some of the percentages. In terms of the preparation of the report, we didn't have complete data by the time the report was submitted. However, we will be finalizing that information. Our intent is to come forward with a department annual report, which will provide specific detail on all of the data points for 2025. That report is anticipated to be released shortly. Some of the highlights with fire operations data: we have overall fires decreased by 4.4%. This is largely due to the decrease we saw in Q1 of 2025. Decrease of 4.4% is nothing to get excited about. We continue to be a very busy service, and also borne out in the data is the fact that vacant building and structure fires continue to increase by 6.9% in those first 3 quarters. So it's important to note that the vacant property fires are both a mix of structures and non-structures on the properties. In terms of medical response data and some of the other points outlined in the report, I'm going to ask my colleagues to speak to some of these. So Deputy Chief Sneath, I'm going to ask to speak to the medical response data and substance use data that's outlined in the report. Chief Gilmore will provide some information on the encampment data, and Program Manager Linda Hattout will provide the updates on Waverly West and the traffic preemption. Chief.
So in the graphic there, it displays 3 different time periods. So if you have a color picture there, there's the lighter green, darker, and then darker green again. That's 2018 to 2022, 2022 to 2025. And then we made a change to how we dispatch our resources in April of 2025. And so that darker portion represents that section of those changes. So this graphic represents a couple things. One is the increasing medical response call volume over a period of time, which is significant. That call volume continues to increase, and it's projected when we look at our predictions going forward, what that will look like in 2026 and onward. Those call volumes continue to increase, which goes along with pieces that Chief Schmidt mentioned, specifically related to the drug and alcohol or substance abuse concerns we see in the community, and the sheer number of responses we're doing related to that. And then also population growth. So with more people, there's more access of services and people requiring more care. And so we see those numbers going up over a period of time as our population continues to grow. One of the reasons why we made the change to how we dispatch our resources in April is because we wanted to use our resources most effectively to respond to incidents that were critical emergencies. So heart attacks, strokes, major traumas. There is a time standard for which we want to respond to those, and we want to have from time the person phones into our communication center to when a unit or a paramedic is arriving at their side in less than 8 minutes and 59 seconds. So that's a standard used across the nation. We were not meeting that standard. If you look at the data further down there on the graphics, the 2018 to 2022, it's a bit hard to see on there, but we were responding in 9 minutes and 14 seconds. So that's 90th percentile. So 90% of our incidents, we had a paramedic to the patient's side in 9 minutes and 14 seconds. So beyond the standard of our department. In 2022 to 2025, we were at 10 minutes and 48 seconds. So that time was continuing to expand with volume of calls, volume of resources, not matching with the volume of calls or responses. We see that time going up. When we made the change in April, if we compare that period from April till November, when this data set was run, we were at 8 minutes and 13 seconds. So there was a positive effect in the change in what we did with utilizing, not sending as many resources to the low acuity calls and holding some of those calls and dealing with some of those calls through our community paramedic program to create more efficiencies in operations where we could get a paramedic to the patient's side in a much more timely fashion. We also instituted a number of protocols in place that crews could queue the call. So if a fire apparatus, as an example, has responded to a call, they have the ability to queue that call for a dispatchable transporting resource at a later time. So if they find that they respond to an incident and there's no acute medical emergency that they need to intervene on, they can release themselves from duty and that will come back to that patient, but they sit in a queue in our dispatch center waiting for a response at a later time. So we've made a number of those changes. We continue to make a number of changes to create efficiencies in regards to our medical response volume. That change in April resulted in a 2 minute and 35-second reduction in response to a patient. That's a significant change. That's a significant change when you're having a heart attack or when you're suffering from a cardiac arrest. That's the difference between life-saving intervention and poor outcome for a patient. And so those are good changes, and we continue to make those operational changes and efficiencies as we move forward into 2026. And talk about the utilization rates if folks are interested in some of that data piece. Also, it's not included in this report, but certainly give you perspective on how utilized our trucks are, if that's helpful. So EMS is, when they're assigned to incidents, they're assigned to incidents 68.8% of the time. So the national standard for ambulances is between 35 and 45% utilization. Anything higher than that, you start to see increased zero ambulance availability, increased burnout, increased sick time, increased WCB claims with staff because they're being overutilized. The measure in the industry is intended so that when you phone 911, there's a resource available to send to you. You cannot utilize an emergency service 100%. Otherwise, it's not available for you when you phone 911 or when your house is burning down or when there's other things going on. Fire is their current utilization rate, and these are posted online, is 17.83% for 2025. So that's to the end of 2025. We've seen an increase in fire utilization, largely related to medical response. Some of the changes that we've made with our dispatching is intended to reduce the number of times fire is responding to medical calls. And so from between 2024 and 2025, we reduced that by about 5,000 calls. We continue to try to reduce how often we're utilizing fire apparatus for medical calls, particularly low acuity medical calls. And that's where the community paramedic program comes in, where we're trying to offload some of that volume onto the work that they're doing. So the availability for ambulances in Winnipeg is about 35%, and the availability for fire apparatus in Winnipeg is 82%. Ambulance availability is 48% of the time they're in the station of that available time. So only half of that 35% is actually in the station. The rest of the time they're out driving on the road, coming back from the hospital. And so the data really shows us that they're largely not in the stations at all, and they're getting assigned to call after call after call. And so that has a fairly negative effect on our ambulance crews. Just as far as volume goes, EMS only was assigned to 34,000 medical calls last year. Fire only to a medical call was 22,000, both 22,500, it's 486. And combined response was 61,353. So incidents where fire and an ambulance were assigned together to an incident was 61,000. That's gone up since 2020, for. And that's a number we're gonna focus on this year, reducing. Do we need to send dual apparatus to all of these incidents going forward? So there is a number of efficiencies that we're looking at in 2026 to refine how we're using our resources, recognizing that there's quite a strain on all of our apparatus in the city.
On the encampment data, so our fire prevention team and the community risk reduction team does work closely with Greg that was just here on the encampment protocol and as part of the Your Way Home strategy with the province. So for our numbers for fire prevention, we did change the way we dispatch to encampments in 2025. So previously we had one specific individual that was assigned to encampments full time. What we did for 2025 is made it so that all our fire prevention inspectors can go to encampments. So we're able to get to an encampment if there's an immediate fire safety risk much faster that way. It has changed our numbers. So for example, in 2025, there were 576 visits to encampments, but those are all based off a request. So a report of a fire safety risk, a known fire safety risk that we're checking in on, something from 311 or another operations team in the area. When we had one inspector assigned that was just doing encampments, our numbers were 715 and 791 for 2023 and 2024. So we are in encampments a little less, but we're able to get to the risks a lot faster. And we're able to focus on the fire safety concerns. So then we also have the number of fires, the encampment fires, and it was 543 until the end of November for 2025. That's compared to 512 for 2024. So it's a slight increase, but we do know there were more encampments in the city last year. And so the increase is not alarming at that point. And then I just wanted to be clear that by encampment fires, the way our system works, it's any fire that is considered homelessness involved. So it doesn't necessarily mean a large encampment fire. It can be a call to a fire in encampment, and when our crews arrive, they find it's a small campfire that they're maybe not even extinguishing, or that it was a report to a fire and the fire was out when we arrived, or it could be a fire in a vacant lot that appears to, being started by somebody, nobody's present. That could be considered homelessness involved as well. So these are full encampment fires that we're talking about.
Provide an update on the permanent Waverly West station. So we are now operating out of the modular station, and we have been for the last year. The permanent station, there has been a little delay in the tendering process due to the development of a new design build package that is not yet ready to use. So we've been a little delayed on that tendering process. We're looking at doing it a different way. We're still hoping to be in there late 2027, more likely 2028. And that will be on the corner of Ruth Crossing and Bison Drive. The modular at that point will be relocated to our location in Centerport, just east of Sturgeon Road. We have a couple of sites that we're finalizing as potential locations for it. Once that modular station is relocated there, the apparatus from Station 19, as well as the ambulance from Station 36, will be relocated to the modular, and those two facilities will be closed. Next year, we're also starting to identify land for a permanent Station 4, a new Station 4, Station 30 combination on Osborne. The current Station 4 is woefully inadequate. So next year, that'll be the primary objective, is identification of a new curve for that new station. On the EVP project, emergency vehicle preemption, we had a kickoff for the project. Public Works will be hiring a couple of traffic engineers and technicians to install the units, and we'll be putting up the tender or the purchase order for the equipment in the next couple of months.
Wonderful, thank you. So in terms of next steps, as I mentioned earlier, the department plans on bringing forward an annual report. The intention in this report, and I thank Chief Sneath, some of the information that he provided this morning here in terms of additional availability data and such will be included in this annual report going forward. It was our intention to try and include that annual report as an appendix to this strategic update report. However, given timelines, we weren't able to achieve that. So we'll be bringing it forward as a separate standalone document. Important to this point in terms of our availability or ability to report comprehensive year-end information. Like again, to direct the committee's attention to recommendation number 2 of this report, and that would be that this annual strategic direction update be submitted to the committee in February of each year, commencing in 2027. Up until now, this report has been due in December. That doesn't permit us time to provide a good picture of the entire year. So we'd like to, with the committee's approval, move the report date into the following year, 2027 in this case, so that we can provide that comprehensive view. We had to request an extension in December to bring the report forward now. That is the recommendation that we've put forward. And then one final comment in terms of community risk assessment reports. It's our intention to update the risk assessment, and we'll be utilizing the personnel and knowledge that we have within our research and data intelligence group at Fire Paramedic Service. That group is under the leadership of Assistant Chief Andre Berard. So that is the next piece of work that we'll be undertaking.
Thank you, Dan. There was a question about updating the standards of coverage. And Chief Berard's team, with the help of a new system called DECIM, which is referenced in this document, will help with modeling response times and be able to allow us to do that standard of coverage dates. Very useful.
That concludes the report, so we're happy to take any questions committee may have for us.
Okay, so with respect to your next steps, submitting an annual report, which includes call data for 2025, you had mentioned, Chief Sneed was gonna include some of the data. What other data is gonna be coming out of that annual report that's not gonna be in this strategic direction?
Very specific call response data. So we'll break everything down in terms of all the unit availability, types of determinants that our crews respond to, or the types of call determinants that we process through the queue. So it'll be very detailed report. One of the challenges that we've had in terms of comparing where our service is across other jurisdictions is we've for a long time participated in a national benchmarking initiative, but we found that a lot of our comparisons have dropped out of that process. So that is very difficult for us in terms of having that available data. So the one thing that we do know is we in terms of the impacts that the volumes have on us here, we can look at our own metrics. So we know that we have a large number of staff that are off work at any given time due to workers' compensation and other injury. So these are things that we have to look at and will also be included in the data that we bring forward. So this will be a very comprehensive package, and it's our intent to bring it forward on a yearly basis. Many other jurisdictions, fire and emergency services produce annual reports. This has never been the case for Fire Paramedic Service, but our intention is to change that. And part of it is to ensure openness and transparency.
So when is that report coming for? Is that in March or April? When should this committee expect that report?
The
hope.
Yeah, so our intention Our intention was to bring it forward as an appendix to this report. We're not, in this type of report, we're not limited to simply bringing it forward through the committee structure. So we're going to explore other options too. That we may, we produced other documents that simply are released publicly. So we may do that in the interest of time, because I anticipate that report's going to be finalized within the next month. But due to the timelines associated with entering this information into the report structure, I'd like to get visibility on the report sooner than later.
Question about the community risk assessment standards and the master plan. I think you touched a little bit like that you were going to be updating it. Is that what I heard? I heard
Yes,
that.
I'm going to ask
Okay,
Chief Sneed
yeah,
to speak
could
to you, give you a little bit of
expound
insight
more?
into
Yeah.
the team that has been assembled.
So we have a team of, they're not data scientists, but a number of them are PhD trained. And looking at our data from a perspective of a predictive analysis. So they're looking at our data from the last, most of the data sets, they've gone back 10, in some cases they're going back 20 years to look at a fulsome view of what our data can look like going forward. When they're mapping that out, the program that Lynn mentioned, Deccan, is a software program that essentially integrates that into our current CAD systems or dispatching system. Pulls all that data together to say, here's what a map of the city looks like as far as your responses. It allows us to use that alongside our dispatching system so that we can make more informed, intelligent decisions about how we use our resources, what times of day we can expect call volumes to go up, and in what jurisdictions we can expect the next fire to occur. So that we're able to even move resources when there's times of degraded in a certain area. So it allows us to.
Decon, what's that? Sorry?
It's a software company. Deccan is the software.
Oh, it's a software company. Is this using AI or is this going to be more manual?
It's using our historical data, so it's not an AI.
Oh, okay. And it's being attached to CAD and
Correct.
our maps?
Yeah.
Okay, okay. And then what are you going to do with that data?
So that's the data that we'll use to predict how we use our resources in the future and what additional resources we'll need. So it will give us more of a predictive for anticipated population growth can be built into the modeling that they're using. Types of growth, if we see more growth in impoverished areas, we know what kind of call increases we see in those areas. So it really does give us a more fulsome picture of what resources are we going to need.
When you say resources, do you mean paramedics, like operationally, or do you mean capital resources as in more fire apparatuses? Because we're hearing from delegates like,
Yep.
we need both, but
Yep, it
is
will
it
do
going to
both.
take those into account?
It will do both. So when we look at the call types we're responding to,
Mhm.
and the type of resource we're trying to align with that call type, it isn't necessarily always an ambulance and isn't necessarily always a fire apparatus. It could be a community paramedic resource also.
Mhm.
And so it does take a fulsome picture to say, you're gonna need additional stations in this area purely based on growth and size and travel time. But it'll also give us resources where you can expect an increase of call volume in this area for this type of incident. So it'll help us be a little more precise with our asks going forward.
And I'm assuming that this information will be shared with the province as well on the EMS side
Yeah.
to let them know what resources we require from them as well.
So we have a standing dashboard that's available to them as part of our contract that shows our response data all the time. So they have a live view into our system all the time on a daily basis where shared health representatives and executives can look at the responses, look at our utilization rate, particularly our ambulances, but it sees our overall response volume within there.
So I'm gonna ask the question, what's the time frame as you're doing all this data collecting, and the decon and updating the risk assessment? Can you give me an expectation of time frame? Because you have a certain team that's dedicated team that's working on this, or is this gonna be off the side of the desk?
No, this is a dedicated team
Okay.
working on this. So this is, the Deccan project is a project on itself. It has a project lead and staff that are dedicated to that.
Okay,
and hired
perfect.
to do that. So that will be implemented by the end of this year.
End of this year?
Yep.
Okay, and then the updated risk assessment, is that gonna be also coming out at the end of this year, you're hoping?
That's
That's the hope,
hope,
okay,
yes.
okay. Okay. Yeah.
I'd like to add the piece on shared health and their visibility. So as Chief Steve indicated, we've provided them with a live dashboard, so they're very aware in terms of the resource allocation and the volumes we're experiencing here in Winnipeg. Last additional FTE came in the budget with community paramedic programming. But in terms of transport ambulances, we haven't seen an increase in transport ambulance complements since May of 2023. And that coincided with the signing of the service agreement that we have with Shared Health. In terms of the volume, so you will see in the annual report, EMS incident type determinants come in at 120,049. So that's a significant number of EMS calls. Fire calls 21,338. The issue is the deployment model that we use here in Winnipeg with deploying firefighter paramedics on our fire apparatus. Due to the strained resources in EMS operations, paramedic operations, that has now flowed over to fire operations, and we're relying heavily on those firefighter PCPs to address the medical volume in our city. And that is one of the key factors over and above the fire call volume that we have relating to derelict structures. That's one of the key factors that's putting strain on the system. So this is something that we're in discussions with Shared Health. We have a joint operations committee with Shared Health where we discuss the status of the service. The reality is EMS across the province is strained. So the same challenges that we're facing here at PEG, folks at Shared Health are facing similar issues in rural Manitoba. So the answer to that will be continued investment in pre-hospital EMS. And that needs to occur sooner than later. Also, within the service purchase agreement, there are clauses in that agreement that speak to mutual aid. So due to the fact that very recently we've had a number of EMS incidents where we've had residents of Winnipeg waiting 13 plus hours for an ambulance to transport them to the hospital. We're initiating the process to discuss mutual aid with Shared Health, wherein there may be circumstances where we request the services of a provincial fleet ambulance to respond to incidents within the boundaries of the city of Winnipeg, so that we can service these calls in a timely manner. This will very likely result in ambulances from areas like East St. Paul, West St. Paul, around the capital region of Winnipeg, being requested to provide service within Winnipeg so that we can get these calls serviced in a timely manner. We don't have our residents waiting 13 plus hours for us to get to their door.
I don't, I did have one kind of follow-up question, 2 points, and I didn't catch it, but you said in the, and it might be just a typo, but the operating budget highlights for 2026 approved in 25 include the following: 40 additional firefighter FTEs. I think when I went back to the budget recommendations, it was accelerating the program in a sense where it was 20 FTEs we were funding in 2026. And then I think the other 20 additional firefighters were going to be discussed during the budget. Like, so I just want to get confirmation on the numbers here because it made it seem like that we have committed 40 FTEs, but I think the recommendation was 20 in 2026 and then 20 in 2027 for a budget referral. Is that correct? Okay.
That's correct.
Okay.
However, with the language that we have and our ability, we are able to hire more individuals in each FTE position. Okay, based on how the resource language is constructed,
Okay.
the resource pool language. So that's what we're going to be proceeding with. We have, so that is not a typo.
Okay.
February 9th, we have 24 firefighters starting at our academy. 12 of those individuals are have firefighter certifications, and the other 12 have firefighter paramedic PCP certifications. So that class of 24 will start February 9th. That class was a planned class in advance of any budget deliberations, and that class will in essence address our retirements, either that have occurred or expected to occur. And that class will be out into operations by April 9th, which is good timing. That will help us with in advance of summer vacation. The resource pool FTE, that bulletin just closed. Those folks will be brought in after the recruitment is completed, and then after the April 9th class, after April 9th, that next class will then come into the academy. That will be the start of the resource pool training. So resource pool firefighters will not hit operations until, late summer, early fall.
2026.
Yes, and that was identified in the budget as well in terms of the costings that they included. It wasn't expected that they would hit the road in 2026.
I appreciate the clarification. And then could you also let me know about, I had thought, and we had purchased additional ladder units and engines in the 2025. Not this budget we passed, but in the previous budget, is that correct?
At the end of 2024, there was an ask, and those were delivered in 2025.
So they were purchased and delivered in 2025, so they're on the road now.
They're not all delivered.
Okay.
We purchased 6. We're waiting on a 7th purchase order to go in. Of the 6, I think 2 will be delivered 2 or 3 will be delivered this year and the next year. So
So 2 that's being delivered this year, what are they?
from Gary Pumpers.
Pumpers?
Yeah.
Okay.
2 or 3 on.
And then, sorry, what?
I can get you the exact information. I don't wanna.
Oh, okay.
I think it's 2 or 3.
Misspeak? Okay,
It's 2 or 3 this year.
okay.
And we have a aerial ladder
Yes,
that will be
that's being purchased. Or that has been purchased, but it's not being
purchased,
delivered.
arrived, and there will be more to come on that soon.
Okay.
Yeah.
Yeah, if you can get me that information on the fleet numbers. And could you also get me the numbers, or just me and my committee members? The dollars that was been allocated, what we were supposed to be purchased, what has been delivered, what has not been delivered, and give me some timeframes if possible. Yeah, I'd appreciate that information. Okay, I don't have any other questions. It was a lot to digest.
It's a big service.
Yeah, no, that's great. We obviously have more information. Yes, go ahead, Counselor.
So 2 questions. The first one is just about the benchmarking. So over the last little while, we've been hearing a little bit about these national benchmarking programs, which municipalities participate and which don't. So I just wondered if you could talk a little bit about, that.
So-
Whether Winnipeg participates and
Yeah,
whether.
a lot of the, it's a good question. The larger jurisdictions that actually we are comparable to are not participating. There are some other smaller jurisdictions that are participating, but because of their size, they don't make a good comparator for Winnipeg. The other challenge for us when we look at these numbers, and we've seen it in prior budget documents where some of this benchmarking material and data has been used in budget documents. The challenge is we are unique here in terms of how we deploy our resources and what we deploy. There are many departments across Canada that are single role fire departments, and they do not deploy firefighter paramedics. They do not have licensed paramedics. And in some cases where they do, they have a very limited scope in terms of the type of calls that they will respond to. So in many cases, that would be limited to the most life-threatening calls, such as a cardiac arrest or somebody with extreme shortness of breath or allergic reaction. That's not how we deploy here. We use firefighter paramedics for the full scope of their paramedic training. And we've used it to offset and augment the provision of EMS service here. And so the good news is it does get a trained licensed provider to the patient's side in a really timely manner. But as the data bears out, and you'll see in the annual report, that's had an impact on our unit availability and response times.
So I guess with lots of the larger municipalities not participating, that, would you say that kind of drives home how important it is for us to have our own really rigorous data to show whether we are?
More than ever. And it doesn't preclude us from being able to go to other places to look for data. There are other departments that produce annual reports, master plans, their reports to council. So in that case, we just have to dig a little deeper and look to different places in order to get that data. Canadian Association of Fire Chiefs also does an annual census report. But that report is challenging for us as well because the vast majority of those departments represented in that report are rural, 8-on-call volunteer departments. They're quite small. So again, the ability to have good comparatives is little bit.
Okay. All right, another question. That's so just, hearing these challenges with the department with future housing and population growth and talking about developing whole new parts of the city with housing that previously are greenfield. I just wondered if you could talk about, obviously that has an impact on what sort of service levels that you're able to provide to sort of the existing city and then also to new developments. Is that a consideration? Has it been a consideration in the past when we're talking about building out whole new sections of development? How that impacts the current service and then, what additional resources are needed for the department to service new areas?
So in the past, and when I say we, I mean we as a city, not just the service. We haven't done a very good job of doing that and forecasting needs into the future. Case in point is the fact that this report includes an update on what's going on in Waverly West. So Waverly West, very large development. We've heard it stated before, community the size of Brandon, Manitoba. Rose very quickly here within the city of Winnipeg, and there was no provision for emergency services station, fire paramedic station in that area. So this is something that we as a city have to learn from. This can not happen again. So to that point, we have ongoing discussions, meetings that folks from my department are included in terms of the greenfield and future plan. We've already provided some comment on developments in South Transcona, developments that are planned for south of the perimeter. We've had discussions, comment, and changes to the plans that have occurred in the water tower district. Water tower district, that area, while it won't have an emergency services station in that area, it will be protected by station, the new station at Ottenwood and Cottonwood. There's a requirement for a dedicated emergency services roadway leading into that area that will be used only by emergency services. The area will also be protected by software program technology known as Trainful. So this will provide our responding stations with a dashboard that shows where road crossings are going to be blocked by trains so that they can plan their response. Second phase of that will also include an integration with our computer automated dispatch center so that the computer system that dispatches the resources will know where the trains are. And then finally, that area has a additional level of protection because all of the occupancies where people will live and sleep will be sprinkler protected. So those three things, Trainful, the dedicated emergency services route, and the sprinklers is a first. I think it's something that we need to look closely at as we provide for future development. And additionally, we also need to, beyond the greenfield areas, we need to look at other parts of Winnipeg where there's revitalization going on. And we have, high-rise buildings going in areas or multi-story buildings going in areas that were historically either residential. And so the building is going up higher, means there's more people. So what that means for us in an area like here at in the downtown. Downtown is serviced by Station 1 on Ellen Street. If we start building, additional high rises or buildings that are high in elevation and occupying more people, that complement that we have staffing Station 1 on Ellen may not be suitable to address the population base and the risk of the. So those are all the things that we need to be looking at.
You need particular equipment specifically to deal with bigger buildings.
Yeah, in terms of aerial ladders and yes, and that's another item that's identified in the plan that Winnipeg needs to increase aerial ladder complement. So being that's something that we've been slowly working towards with aerial that we added in the south end station 23 last spring, I guess it was. That was not a net new resource. It was done through a redeployment. We took some squads off duty at Station 1 and deployed aerial and additional pump.
Okay, yes, go ahead, Councillor.
Well, it's got me thinking of like the upcoming, the seemingly constant upcoming zoning bylaw updates. And in particular, what we did in St. Boniface, the Water Tower District. When we're gonna have we need to have a variety of housing in Winnipeg. Sometimes we have greenfield developments that have low density single family housing. In those developments, I think those are particularly difficult to service for your department because of the way the roads are built are really not very direct. It's not a grid system. Is there a way for us here at this committee to sort of throw the ball or get the message to the Planning, Property and Development Committee that what we did in the Water Tower District is something that probably should happen like everywhere in Winnipeg if we're going to have better response times for in an efficient way with dedicated lanes going into, in particular, low density greenfield development where they do occur.
Good point. We've had that discussion with our colleagues at PTND. We also had it with the developer that's in the Water Tower District. So they're aware of our interest in making sure what's occurred in Water Tower
Would they be
does
more,
occur in other
would they be more aware if we moved a motion or something like that?
likely.
Madam Chair? No, not for today necessarily, just it's a thought, because I know that.
We have to start thinking this way.
And then things like Councillor Tran Wood talked about the apparatus and the zoning bylaw changes that have occurred and how that's going to have an impact on the types of apparata that you need. I think that's right. I feel that this committee has an opportunity to get that, I don't want to say sound that alarm, but to make that planning happen at the zoning level, because if we're giving net new property rights, it's gonna have net new costs to your service, to our service. And those should probably be captured, because I recall having read the line so many times, the developer shall at no expense to the city construct. And if we have in mind the idea that we need to build and costs that are related to building, I think that things like having essential services like our paramedic service the buildings that we're now allowing to occur should be capitalized as well through the zoning process, because the beneficiaries of the lands are those who are the ones who are developing the lands, who are getting the new zoning rights. And so I think the time for the municipality to capture this at that time, we need to empower planners, I think. Anyway, food for thought, Madam Chair.
I think it's really important for the South Transcona development to factor in fire paramedic service needs, because it is out of the response time zone. And we need a better strategy there.
So I hope the city planners are listening, or if there's a way to get this message to the city planners, because hearing things like that, well, makes me want them to hear it, so that we can have a city that builds the equipment and the services that are required based on the developments that we're approving.
We are working with the planning.
You are working with them? Okay, perhaps some motion is required then. Perhaps conversation on the record is, anyway, I'm sure you can have conversations with the chair. You will.
Thank you. Sure. Just one more question. So you mentioned that you have been involved with this in discussions for South Transcona, south of the perimeter water tower district. Sorry?
Sorry, and District D, which is west of McPhillips. Just north of where so District D.
Okay. I was gonna ask specifically about, this, we're talking about building out Chief Pegasus extension, and then that kind of unlocks all that land above there. Is that the area that we were referring to?
I think it is, that would be, yeah, that would go through or get to that area, yeah. Chief Pegasus.
Thank you.
No further questions? All right, okay. I'm gonna have a mover for supporting the Winnipeg Public Service recommendation.
I'll move the report, with the understanding that if ever the public service feels that this committee can be of help, that they would reach out through the chair.
Yeah, okay, all those in favor?
Aye.
Aye. Great. Okay, moving on to item number 4. Winnipeg Hoarding and Collecting Behaviors Task Force Update, semi-annual report from July to December 2025.
Yes, so I'm going to ask Assistant Chief Omar to walk us through this report. Thank you.
Morning again. So the original hoarding came from a task force that was created in April 2022. It's changed a lot, so we can finally have some updates on it that I can report today. So when it was in 2022, it was a much larger task force, and the city was kind of looking to see how they can assist with the hoarding, which is of course a medical condition. So what we've done is we've gone back and we've looked to see what services the city can actually provide. So what we're doing is a referral service. So I'll just look forward to what it looks like now in December 2025. We have agreements in place with Agent Opportunity, the Canadian Mental Health Association, and WRHA through their HAWKS program. And the way the group is going to work now is that when we have a referral from a city employee about a hoarding situation, we reach out to that property owner or the individual, if we have their name, ask if they would like a referral, and they sign into the program. They have to provide an agreement that they would like their information shared and to be referred. At that point, we would take the information, meet with our working group, and determine the best place to assign it. And then the working group, that individual, whether it's Agent Opportunity or Canadian Mental Health Association, they would then reach out to that individual and provide the services. At the same time, we do offer referral, like individuals, if city employee were to come across a hoarding situation, they can provide 211 and those organization information right at that point to contact too, so the individual can self-refer. We just restarted this program, so the agreement was just finalized in November of 2025 with our partners to share the information. And so it's just kind of restarting right now. We've had our first meeting in January with all the task force partners, and a number of letters and information and contact points have gone out to the public, to the members that have been referred from the public, to see if they're interested. And that's sort of the update. We don't have updated numbers yet for 20, because we've just restarted it. So I expect in July there will be more.
And when you say City of Winnipeg employees, like, you also like will take referrals from 311. So if I'm a neighbor that's concerned about my neighbor that has some issues with hoarding, I call into 311, and then how will that?
We don't take a lot through 311.
Okay.
Normally it's the employees that are interacting directly at them. So bylaw
Okay.
officers, WPS, WPS, those are where we get a lot of referrals.
Okay.
311, I think, does have the information about other reporting programs. So if you were to call into 311, they'd probably redirect to 211, which would then direct you to Agent Opportunity, Shared Health, or CMHA. the Canadian Mental Health Association.
So there would be an opportunity, so let's say like the community bylaws enforcement team would go out. And if they feel that
Yeah.
it would be up to them, if they would see as, oh, this is a hoarding issue, they would let your team know,
Yes.
and then they would go from there, the next step, but you would still need permission from the resident
Because it's
to share their
to share their
information.
information, their agreement to share external partner.
Okay,
And then the external partners are really the ones that have the resources available to provide assistance. So that's why we're working on these sharing agreements.
okay. Questions, concerns? No. So where does it go from here? Since this is the first kind of semi-annual report, like, are we doing another one for a yearly, or is this it? We're like, we're gonna take this away, receive it as information, you guys go ahead with your program.
We have been reporting some
Yeah.
for a couple of years, I believe.
Okay.
But I think an annual report would also suffice.
Yeah.
There's not a lot of changes now. We have a new structure in place. We have the agreements in place.
Yeah, I'd be happy with an annual report, so we can come back next year in 2027, kind of collecting of how the
Yeah.
program is working. The new program is working, okay? If you guys are amenable to that, okay. Do I need an amendment to the motion here?
Yes, yeah.
Okay. could
So
you
we'll
craft
change it
that?
from semi-annual to annual.
Yeah.
Do you want to have a specific date?
Well, I mean,
or-
it's February,
Yeah.
so we can go, yeah, so they went up to the end of December 2025, so if they could do January to December of 2026, so they would come back in February of 2027. Yeah, because that would give you guys enough time to get it into the RIS system. Yeah, okay, let's do that.
Clerk, it's in order, I'll move that.
Okay,
If the clerk is
working
wants to
on an
confirm that
amendment.
it's in order, maybe wants to read what it is that okay.
Yep, so you're concurring in the recommendation of the public service, which is to receive this report as information. And then we're adding a new recommendation 2, that the semi-annual be converted to an annual report commencing in February of 2027.
Perfect.
Yes,
Yeah, okay, thanks, Councillor Large, moves that amendment, all those in favor?
Aye.
And that's carried. Thank you, I
Very good,
appreciate
thank
all
you.
the great work you guys
Thank
are
you.
doing and collecting the data, I know it's a lot, so very much appreciated.
that's great.
We're gonna take a quick 5-minute bio break for coffee and washroom, and we'll be back in 5 minutes, please, and thank you. Good morning and welcome back to the Standing Policy Committee on Community Services, our regular meeting for February 3rd, 2026. We're back into our reports. Item number 5, verbal report for the implementation of the new bike registration system and bike theft prevention program.
So good morning, councillors. I'm Terry Conley, acting manager of licensing law enforcement services here with me. Just as a little bit of background on what the information we're bringing here and why. Back in November of 2023, council endorsed that 529 Garage be the city's preferred bike registry. So at the time in November, when council endorsed the bike registry, they asked the public service to come back to this committee in April 2025 to provide a verbal report on the statistics information, program information that was ongoing. So we did come back on April 15, 2025. And at that time, again, Standing Policy Committee requested we come back at this time, this meeting, February 2026, with a second verbal update with regards to updated statistics for the bike registry program, along with the participation and promotional initiatives. So just as an overview, and before Terry gets into talking a little bit more about the details, we're going to provide you with the progress on the implementation of the bike registry program. From the start, the primary goal of the program has been to successfully return stolen and lost bikes to their rightful owners by establishing a streamlined and secure method for bike owners to register their bikes. So 529 Garage provides that opportunity. Through this, we're able to track stolen bikes and provide users with information with regards when the bike is recovered. It assists Winnipeg the Winnipeg Police Service with crime event prevention initiatives. And in terms of administration, that's being led by our licensing and bylaw enforcement. In terms of promoting the registry, bike recovery, bike storage, etc. So I'm going to turn it over to Terry and he can talk about some of the initiatives that have happened since inception.
Thank you, Kelly. So just kind of jumping in on the section that licensing and bylaw enforcement has successfully completed. And here are some of the key areas that we've implemented. So as Kelly mentioned, in April 2024, LBE entered into an agreement with 529 to access Winnipeg registration data. LBE continues to promote the bike registry program through multiple channels, including social media campaigns, reader boards at City of Winnipeg indoor facilities. We continue to do website updates to update the information. We have various printed promotional materials that we distribute during the annual Bike to Work Day, hosted by Bike Winnipeg and various other events throughout the city. LBE continues to collaborate with Winnipeg Police Service, Bike Winnipeg, and the Wrench, Winnipeg Repair, Education and Cycling Hub, to exchange ideas on promotions and to disseminate bike registration processes through their networks. This past year, LBE participated in 6 community events, engaged over 250 interactions to assist with bike registrations, distributed free shields, and encouraged residents to register their bikes through 529. And LBE continues to collaborate with several bike shops to talk about integration of bicycle registrations into their operations. Discussions were initiated regarding the benefit of offering bike registrations at the point of sale for new bike owners. Feedback continues to be positive. Most participating stores continue to purchase additional shields for resale, but I can't say most bike shops haven't gone as far as putting it at the time of sale. So it's an option. Here's information. This is how you can do it. LBE provides auction. This past year, LBE provided auction purchases with information on how to register their bikes and offered a free shield for that opportunity. I'll get into the number of that stat a little bit later and discuss this last year a little bit. And in addition to all LBE's support to the program, the Winnipeg Police Service successfully taken the following actions to support the program. So WPS continues to collaborate with bicycle recovery by utilizing Garage 529 registry through property crime members. Garage 529 is being used by the Property Crimes Unit for search warrants and is used by various special units, including General Patrol uniform members. They implemented a bait bike strategy that has been deployed in areas with high foot traffic and identified as bicycle theft hotspots. This initiative has led to several arrests by Property Crime Unit and community support units. The property crime unit actively assists victims of bike thefts and recovering their stolen bicycles when found online. And we have executed over 20 undercover operations to retrieve and obtain stolen bikes to their rightful owners. As more people register through 529 Garage, WPS will enhance their ability to verify the status of bicycles during the routine operation in general. So in a nutshell, those are kind of high level points that we've been working on between ourselves and Winnipeg Service. Just some key outcomes to look at. So these stats are from December 31st, 2024 through to December 31st, 2025. So bicycles registered with 529 in 2025 was 4,987, which brings our total number, so the 2 years, 6,325 plus 4,927 equals 13,318 bikes to date that are registered. Of those 13,000 plus bikes that are registered, 1,700 of them are purchased and have bike shields on bikes, which is a good number. I had mentioned earlier, we went down the path of providing literature for bikes that were purchased at our bike auction with the hope that people would register their bike and in turn get a free bike shield. Unfortunately, the numbers weren't quite as high as we were hoping. Of those bikes that were sold at auction last year, I believe it was around 500-ish. Only 39 took advantage of registering their bike to the free bike registry, and 36 of them opted to receive the free bike shield, 7.2% overall, which is the greatest number. However, with that being said, there is a next stage in regards to our plan of what we're doing this year. I'll get to those stats very shortly. Some bicycle recovery stats just to make you aware of. So bicycle recovery by bicycle recovery officer in 2025 was down from 2024. 2024 was 681. 2025, we recovered 641 bikes. Of those 641 bikes, 56 of them were returned using a 529 system. So it's kind of further broke down by 26 bikes were directly returned for our bicycle recovery officer. 9 of those bikes were returned directly from the police service, and 21 of those bikes were returned by the public directly using the 529, which is good. So that's a new number that we are really excited to see about. There was a decrease from the numbers of bicycle returned from 2024 to 2025. It went from a 15% rate down to about a 9% rate in 2025, which really tells us we need to continue to promote the registry to ensure that people are registering their bikes. So just jumping right into next steps, ongoing promotion. Once again, our goal is to really continue to work hard on our promotion, including partnerships with local schools, bike clubs, bike stores, and various city events. We want to continue to get the word out there, to get as many people registered as possible. We're looking at being in the stage now of gathering some feedback in regards to opportunities to see if we can improve the system or to enhance user experience. We'll continue our discussions with bike shops in regards to promoting point of sale of a bike registration system. We've started some discussions with the Active Transportation Branch in regards to continuing promotions of registration through 529. We're also planning on connecting with various biz groups within the downtown to once again start promoting the bike registration and to get some better ideas in regards to how we can promote it through their networks and channels. And then the bike auction registration, we're actually going to have officers on site that will assist people with registering their bikes and putting on the shield when bikes are picked up that are purchased from bike auction. And I think that kind of summarizes the updates. Questions?
Questions? No questions? I would just say thanks for your good work on this. I have my family's all of our bikes have the shields on them. I have the app. I get the notifications all the time. Like clearly this is, this whole thing is working. So just want to say, great. I just see like real world improvements on this. So thank you.
Any other questions? I think this is just the one update, right?
That's right.
I'll make the report.
Okay, you'll move the verbal report?
Yes.
Okay, all those in favor?
Aye.
Aye, that's carried.
Thanks, folks.
Thank you.
Hey.
Okay, we'll move on to the addendum reports. Item number 6, city play structures. We have Jen Berezowski here. We had Councillor Mays come out, speak to the item. Got some clarity on play structures located on school properties. I was not aware that we had that.
Yeah, we do have a number. So in the discussions with Councillor Mace and the report back requirements, first of all, we concur we can get information back in 90 days. But there's a number of school sites where we have play structures that we would call on school division grounds with an adjacent city parkland to it, where we have play structures on the school division grounds, which would be maintained by the school division. They're not maintained by the city. And then there's an adjacent park where there's play structures as well that tie in. So what Councillor Mace is referring to is it'll look like the entire school, or maybe it'll look like a portion of a park. And he wants to know what's on the school side and their condition as well. So one of the challenges we have is where the school division is maintaining those structures, we more than likely don't have a lot of condition information, but we'll report that criteria back as to what falls in the bounds of the school division and what sits outside, where he refers to adjacent. And if you kind of look at the examples that we were talking about earlier, if you called up HS Paul School or you called up Darwin School in that South St. Vital area, you could see quickly that, okay, it looks like it's an entire school grounds. Portion of that is park responsibility, and then there's play structures at that are city play structures that the school division maintains. So
with assess for current conditions, if you don't know the current condition, can you at least insert the year it was installed?
Well, we think so, based on what we talked about. So there's a number of things is that with our playground inspections, we think we have a really, really good handle on the conditions of our infrastructure. But where we're not under the maintenance responsibility, what's been located in our GIS is the date that was handed over or transferred. So for example, if you looked at I think it was Darwin School, you can see a city play structure there, and it was handed over under school maintenance requirements in 2004. And then we'd have to look at some of the outstanding issues might be after that, how detailed do we get? Because we might have a joint use agreement that shows some maintenance services. So we'll see how quickly we can pull that out. It's recognizing the differences, and I guess to differentiate between volunteers that are putting together community funds towards play structures versus city provincial type of responsibility. So
You in my first term, so
Yeah,
I understand.
well, that discussion will further be elaborated when we provide this information.
Okay, so sounds good. We don't need any amendments. We're good as is. And I got a mover, I guess Councillor Allard.
I'll move it. Came from Riel. Sounds like we have concurrence with the public service.
Okay, all those in favor?
Aye.
That's carried. Thank you. Moving on to Bonnie Vital Pool renaming. Would that be yourself? Okay.
Community services, yeah.
Was it yourself that moved it, Councillor Allard?
Yes.
Okay. You wanna
Yeah,
speak?
since it's a political motion, maybe I'll speak to it. I think Councillor Mays had originally thought of naming the Bonavental pool, the Dan Vandel pool, the Christine Bonavental pool, in honor of Dan Vandel, given his exemplary public service. I think he's an ideal candidate. I know this is going outside of the naming Winnipeg process, but you know, I think sometimes you can make a call, and I think this one's a good one personally, but that's for your consideration as a committee. You know, he's Indigenous, he's honorable, he's a minister of the federal government. He represented both wards for I think he's had 27 years of elected public service, and for those reasons, I'm moving it. We do have precedent on other namings that were outside of the Welcoming Winnipeg naming committee structure. I do think that this one would be supported by the community in general. So for that reason, I think it's an okay one to move forward.
I do have questions because you've asked the department to report back on the feasibility of renaming because this is outside of the Welcoming Winnipeg.
Yeah, well, I mean,
what was your thoughts around that?
we don't need a report. We can move it forward politically if well, this committee agrees, if the public service says within our powers. I know that in the case of parks, it goes through the committee structure. In the case of things like parts of parks, or I think in this case pools, I don't think that there is policy on that, but I may be informed otherwise if that's the case. And if there isn't policy, then I think we can move it up.
Yeah, just a couple of things. Thanks for the clarity. Do appreciate what you are looking for. Just a couple of things referring to policy and what you were referring to as parks policy. There was a 1979 policy that originally was titled, it was guidelines for renaming parks and recreation sites. And then a year later, it was renamed and amended in such a way that it was now about parks. So I've read this over. I believe that it just applies to parks. I'll check with legal services, but it really does seem to pertain to parks and not sites outside of parks. And of course, as you mentioned, there's the welcoming policy.
Yes.
So there's that. The only other consideration we might be able to and can provide some information, whether through a report or just provide it to the committee, is the cost to rename the pool, like in terms of the signage, et cetera, within the building, that there will be a cost to do the physical changes, should this be the will.
Perhaps I could amend the motion to say that the renaming costs would be funded through the Riel Community Committee. You know, it's a partnership motion with Councillor Mays and I. If we have the funds available, like make it subject to funding being available from the ward councillors' funding allowances.
We can determine what those costs happen to be.
Okay, my last question, or another question would be, does this end here or does it go all the way up to council?
I don't have that information. I don't know without a policy on renaming it. I don't know if it belongs to this committee or not.
You have to look to the clerk.
It may need to move up, so
I'll kick it up a notch then.
Sorry, say it again.
I would propose kicking it up a notch, subject to funding, kicking it up to EPC, subject to funding from the ward allowances of the Riel Community Committee and or other funding. We have the Investing in Communities Fund, we have the capital, we have the operating, we have Land Allocation Reserve Fund, we have the per capita fund, we have the Community Incentive Grant Program. Out of all those sources, I think Councillor Mays and I.
Feasibility of renaming, what are you looking for?
Well, I'm just looking for the words that are written in the motion to appear on the pool.
So the actual name, the French and English name with councillors.
Yeah, perhaps on the way to EPC, it'd be vetted by like our City Winnipeg French language services to ensure that the translation is appropriate, because that came out of my head. So it'd be good to have it vetted by translation service by the time it hits EPC.
And then again, I'll double check on that 1997 policy, but it did make us request.
It just seems like the right spot between the ward, Bonaventure, St. Boniface, St. Vital.
Buildings. I know with renaming of buildings, we had a Welcoming Winnipeg policy that was supposed to deal with buildings and even parks and
Yeah, I don't know the full extent, but I do know that there was an extension granted by council in November to come back.
But we've had councillors just politically push it through council.
That's what I'm doing.
That's what you're doing, you're politically pushing it through council?
Frankly,
Okay, so
yes.
then are you then, the feasibility of renaming, are you looking at the feasibility costs of
No,
renaming?
no, because I think we can make it subject to funding from the Real Community
Okay.
Committee board councilors.
Okay,
For
and
the
then are
cost to be
you,
absorbed there.
but then the French language side of it?
That's really not, I don't think that's a material cost. It's just
Okay.
ensuring that Nicole Young in our French Language Services Division ensures that the French is proper.
Yeah, we do. We have a process. Everything goes through French
Yeah.
language, through French language services for translation, so we can confirm.
This would be a bit of a hybrid though, right?
Probably get that confirmed today that if you wanted to be Dan Vandel,
Well, specifically
Bonnie Patel
Kissin, Bonnie
Pool.
Patel Pool.
like what you
Kissin-
particularly want to be.
Kissin, Dan Vandal, Bonnie Patel Pool.
Okay.
Yeah.
Okay.
Because then you have, that works in French and English, I think. Because the way the languages work, if you have it set up that way, then the French read Kissin, Dan Vandal. And then if you read it in English, it's Dan Vandal, Bonnie Patel Pool. So like
We
if you
can-
read the left side or the
I
right
can
side.
certainly put this, put this request in today and ask for that.
I think because
Subject to
you're
funding.
waiving, well, and that's the thing, subject to funding, and then you're waiving the Winnipeg welcoming.
Well, I'm not sure that I am. I think we're still working on that policy.
Well, there's no time frame, so you want it to still go through welcoming Winnipeg?
Well, no, I would like to move it. I would like council to vote on it. That's why I would like it to go up to EPC. And I think.
I don't know how that works, but okay.
Well, because there currently is a welcoming Winnipeg
Winnipeg
policy
policy,
in force.
yeah,
I know
there
there is
is.
a review, but the current policy still is there.
Yeah, I've
Okay.
seen other motions where it says it basically waives the welcoming Winnipeg policy.
So then I'll move that.
So I think you have to say here, real community recommendation to the Sandpile Committee that the public service waive the welcoming Winnipeg policy and be directed to report back on the feasibility of renaming.
And I don't want to report back. I just want to do it.
Oh, you just want to do it?
Yeah.
Okay. Winnipeg Public Service be directed to waive the welcoming Winnipeg policy to rename the Piscine Bonnie Patel Pool to the quote Piscine Dan Vandal Bonnie Patel Pool in honor of his significant lifelong contribution to the City of Winnipeg and St. Boniface, subject to funding.
Yes, from, subject to funding from ward councillor, subject to ward councillor funding from the Real Community Committee.
Well, real community is 3 councillors, so you want
Well,
just
subject to
2?
fund, how about just subject to funding, just period?
Just subject to funding?
Yeah, so then if Councillor Mays and I can scrounge up the funds, whatever they are.
But you're not looking for funding from the public service.
We're not looking for net new funding. I'm looking to fund it like within our allowances.
An appropriate source of funding for this would probably be the land dedication reserve.
Yeah, something like that. But I just, if we're general on the language, then Councillor Mays and I, I'm sure we'll be able to figure it out. Councillor Mays in particular.
Because this would be mostly for signage, which would be, all things considered, a fairly small sum.
Well, it can be scoped down or up, depending, right?
We can put it on the building.
Yeah,
It's gonna be on the building.
On the
I can't
building.
recall if there's a freestanding stanchion with a sign name, if there's reader boards,
We were
whatever.
just there opening, it.
Yeah.
I think it's on the building.
I figure if we can get this through council with the subject to funding, then we can probably, Councillor Mays and I and the public service figure it out.
Okay, so this will go up to EPC and council.
Yes.
Okay,
So-
okay. So moved. Okay, and Councillor Duran, what? Yeah, go for it.
Can I speak to it?
Absolutely.
Yeah, so I guess the first thing that I wanna say is, my thoughts on this have nothing to do at all with whether, Dan Vandal is a worthy person to name things after. I spent some time last night, researching, about him and very clearly, really, like you said, a person who has, given decades of public service, great record, particularly as an ally to the Indigenous community, being Indigenous himself. So nothing to do with that. But I think as a society, we really need to start thinking more about whether we do place namings after people. It's a direction that other municipalities are moving towards. And I do think that the Welcoming Winnipeg model overview is really important. And so personally, I'm not comfortable moving this forward without it having going through that review. I understand that's sort of still in limbo, so So I guess that's my position, so although very supportive of, a way of honoring them and I think I can support, this motion.
Well, I guess, Councilor Santos, I don't want to move a motion yet and have it defeated, so what are your thoughts?
I
If
am,
we refer this to Welcome Winnipeg, I don't know when it's gonna
no,
happen.
unfortunately.
If we move it up to
yeah.
EPC, it's gonna happen,
Yeah,
as long as EPC says yes,
well, as long as EPCs, yeah.
and
So-
as long as council says yes.
Yeah.
So there's still two other, rungs to go up.
Mhm. I can support it up to EPC.
Okay.
And then you can have further discussions there. Come out in delegation if you can get more letters of support.
I'm sure we could get tons of letters
Yeah.
of support, and
Okay.
I mean, he's
Mhm.
not only is his leadership style like, I mean, he was very pragmatic. He had multi-partisans, I think, collaboration. He would work with any political party. He'd work with anybody. So I think the support will be there. If we need letters of support, we can get them.
You're the ward counselor, so I tend to support the ward counselors when renaming. There was a point in time where we used to do a lot of renamings in my first term, or even as an executive assistant to my Factican.
Yeah.
And it was something that counselors had done. The Welcoming Winnipeg process has kind of interjected, and I completely understand what Councillor Duran-Wood is coming from. I think that process still needs to be probably not so much rewritten, but definitely needs to come back. I appreciate you bringing it out and flagging it for us. That is definitely a piece that's missing, and reconciling with our past and ensuring that we have more history of our First Nations, Indigenous peoples in our names and places. But I'm supportive of moving this forward to EPC with further conversations with council colleagues. So I'm not going to fully support it yet at council,
For
but
sure.
I think we can move it up to EPC and have further talks.
Excellent. Well,
Okay.
thanks for the support, and I'll keep making my case.
Okay, sounds good.
Or Councilor Mays and I will keep making the case.
Yeah.
And whoever else wants to join the fray.
Sounds good.
Yeah.
Okay, all those in favor?
Aye.
Aye, those opposed? Okay, Councillor Wood is in opposition.
Recording?
Okay, recorded in opposition, and that passes. Right, seeing no further business, consent agenda and adjournment by Councillor Alar at 11:54 a.m. All those in favor? Aye, and that's carried. Thank